So you get people off of CPAP.
Right.
Okay, so either chronic snorers or these people that have already been diagnosed with sleep apnea. You make these custom-made appliances. Does it work?
It
Do
absolutely
they work?
works. They do. It's basically a substitute. The CPAP, as we said, is very effective. 100% if you wear it.
Okay.
Problem is, 30% of the people are non-compliant, or 30% are compliant, I should say.
So 70% don't even use it.
They won't wear it for whatever reason. We could go into all those, but there's lots of reasons. And you know, I think I forget the comedian said, you know, the CPAP machine is a perfect birth control apparatus. So
Okay.
you can understand. So
Not very sexy.
Yeah, not very sexy. I mean, so and interesting, the studies show that if you do wear the CPAP, actually your sex life improves because you're breathing better and you're healthier. But that's another point. But yeah, these appliances can take the place of that. It's much more adaptable. It's much more compliant in terms of being able to wear it. And we have effects that are as good, if not better, than the CPAP. Long term, they're going to still have to wear some kind of appliance. But we've introduced a new option, and that is to expand the arches with these 3D appliances so that we can correct the root cause. And that is because the mouth is too restricted, it's narrow, there's not enough room for the tongue. We're going to all correct, because who wants to treat the symptoms and who wants to treat the root cause?
Okay.
So I would rather address the root cause. Now, not everyone does because it's a little more involved, and that's okay, but we get great results, and you're going to have a long-term better result with these 3D appliances where we expansion, and we get patients that wear these things, and at the end of the treatment, they're not wearing an appliance anymore. With a CPAP, you're CPAP forever. With a mandibular advancement appliance, you're wearing that forever.
You said results, like what? What is the result? How do we know if it's a good result?
Well, tests show it for sure, but patients come in, they're feeling better. They're sleeping through the night. The spouse is not complaining. They're not snoring. They're not sitting there watching their spouse gasp for air and not knowing if they're going to take another breath. They have more energy during the day. They're not falling asleep while they're driving. This is a huge problem. So, and I think everyone has experienced that, and we all try to push ourselves, but it's a physiological process. When you become tired behind the wheel, you cannot stop it. You will go to sleep, and you will run off the side of the road, and hopefully you won't cause any damage or hurt anyone else, but it happens. It's not like, oh, I don't want to eat, so I won't eat. You cannot stop that process. So if the body's not getting enough oxygen during the nighttime, you're going to have that daytime sleepiness. This improves. We see this all the time. I can go throughout the day. When I get home from work, the patients say, I don't fall asleep in the chair watching TV. I can stay up. I can exercise. I can go to the gym after work. We hear these cases after cases.
They have energy again.
They have energy.
So they think they're sleeping and they're not. They're waking up all the time, but they don't even have a memory of waking up every hour.
No, their only complaint is they're tired. And they think, they go to the physician, it's normal. You're just aging. Everyone's tired. And because, isn't it true? It's becoming the norm.
Okay.
Yeah, the most common complaints people have is fatigue. We hear it all the time. But why are they tired? I mean, there are certain reasons other than that.
Now, in your book, Stop the Snore, great book, by the way.
Thank you.
That you say that depending on what training the dentist had, they usually go and they offer one appliance. You offer many appliances.
Yes.
And you place a big importance on finding a practitioner that offers a bunch of different types of appliances. Why?
Well, just be careful about a dentist who only offers one appliance, because they probably got trained in one course that was basically preaching this one particular appliance. We're all different. We all are physiologically different. So we need to find an appliance that fits you personally and that's going to best fit you. I'll just throw out an example. Somebody who grinds their teeth. There's a certain kind of appliance you do not want to make for that patient because it's going to lock them up and they're not going to be able to freely move their jaw. So that's just one example. So if you have one particular appliance and that's all you have, then you're treating everybody the same. And it's kind of, it's kind of cookbook. It's the old thing that, if your only tool is a hammer, everyone looks like a nail. So we probably have all experienced, and I did myself. My parents did not sleep in the same room. My father was a heavy snorer.
Because one person snores.
Yeah,
interesting.
We talk about them in the book. 35% of married couples sleep in separate rooms because of the snoring. There's probably another percentage that sleep in other rooms for other reasons. We're not going to get into that. But for snoring only. So the consequences are keeping the spouse awake, so now they're not sleeping. The one who's snoring thinks they're sleeping, but they're fatigued. And there are even recent studies that show there's auditory changes that occur due to the decibels of the snoring. So there's a lot of detrimental effects that occur from this, which we used to think snoring was so benign, but it's not benign.
So what treats better? The chronic snorers, are they easier to turn around than the person with sleep apnea, or is it kind of equal?
Well, we get results with both. But
Okay.
The snoring is generally easier because it's usually in the early stages. So they haven't yet developed the serious problems that occur from sleep apnea. So we have success with both cases. So I couldn't say that one is better than the other. We want to address both because snoring is not benign.
Does snoring lead to sleep apnea?
Absolutely. So that vibration that occurs when someone's sleeping, it changes the soft tissue in the back of the throat. So if not addressed, they don't have sleep apnea now, they will have sleep apnea.
So you had a lot of people off CPAP? Like even people that were using it, but they heard about this therapy just to get off of it because of the inconvenience. Have you ever had anybody that no longer needs it?
We have lots of patients. I have a woman who was on a CPAP, then she started the appliance. We started to see her symptoms improve. She slowly got off the CPAP, was only using the appliance, and now is totally off the appliance. She feels better. She's got more energy. She's going to the gym. She's working out. She's socializing more. She wants to do more things. So you see a drastic change in their life.
So get checked.
Yes, absolutely.
Get evaluated.
Yeah, I mean, what's the harm? Let's find out if that's a problem.
And you say in the book that the appliances of just 3 or 4 years ago are totally different than the appliances today. Like they're
Yes.
more comfortable today,
More
they're more
comfortable.
effective today.
Yeah. More effective. I mean, we're taking a different approach. We're not using the mandibular advancement appliance, which is what a lot of sleep dentists do. We want to correct and get to the root cause. The root cause is that we have narrow jaws.
So increase the height, the width,
Yeah.
and what else?
And the depth.
Okay, all
Front to
3
back.
of those things. And most appliances only treat one thing.
Right. Right.
Lower, bring out
Yeah,
that
and
lower.
understand that it doesn't really, it's just treating it while they're sleeping. It doesn't correct it.
Okay.
So, I mean,
So
we
what
can,
you're doing is correcting it to where they no longer have to wear that appliance?
right. So that's
that
the end
right?
game. The end game is to get off the appliance. So you're not done wearing this for the rest of your life.